Hello everyone, how are you doing today? Welcome to the topic of hepatology. So today we're going to talk about viral hepatitis. Viral hepatitis. But the main subject of today's discussion is what? Viral hepatitis B. But before we go into the main subject of our subject matter, I wanted to have a brief overview of what is meant by the concept of viral hepatitis. Okay, viral hepatitis simply means the primary infection of the liver by one of the heterogeneous group of viruses called what? Hepatitis virus. Currently, we have a number of hepatitis viruses which are labeled with the help of what? The English word alphabet. We have hepatitis B virus. We have hepatitis A virus, we have hepatitis C virus, we have hepatitis D virus, and we also have hepatitis what? E virus. And then the last one, which is hepatitis G virus. Okay, you might ask yourself, what about hepatitis F virus? Of course, hepatitis F virus is in existence, but this particular virus is considered to be a mutant form of the hepatitis B virus. And this particular hepatitis F virus is a cause of the transfusion associated with hepatitis, guys. It's the cause of the transfusion associated hepatitis which is caused by which is a mutant of the hepatitis B viruses. All right. The whole group of this particular hepatitis viruses, they are collectively known as what? Hepatotropic viruses, you understand? Because they affect the liver directly. They have a direct effect on the liver, understand? Okay, these viruses, it's not only these hepatotropic viruses that actually affect the liver. We have other types of non-hepatotropic viruses that affect the liver, which includes, first, we have the herpes virus. The herpes virus. We also have what? The Ebola virus. We also have what we call what? The measles virus, the virus causing measles. We also have what? The cytomegalovirus. Megalovirus. We have what we call the Epstein-Barr virus. Alright, these are called what? Non-hepatotropic viruses. That means they affect the liver indirectly. But on the other hand, the hepatotropic viruses, which are first of all, we have the hepatitis A virus, we have the hepatitis B virus, hepatitis C virus, hepatitis D virus, hepatitis E virus, and hepatitis G virus. Like we said, the hepatitis F virus is a mutant form of the hepatitis B virus. Okay, viral hepatitis could be acute or chronic, guys. Okay, what do we mean by acute viral hepatitis? You can define an acute viral hepatitis when there is a sudden elevation in the serum concentration of the aminotransferase. That's the enzyme found in the liver, right? Yeah, exactly. And what caused this increase in the level of these particular enzymes is due to the necroinflammatory injury to the liver, guys. You understand? In acute viral hepatitis, we have immune response. You understand? That is quick immune response as a result of the infiltration of the virus in the body. We have the body react to it, and as a result of this immune responses, you understand, we have damage to the liver, which is done by T lymphocyte, them releasing we call cytotoxic substances, and we are coming into that when we're discussing hepatitis B in details actually. So, like we said, there is increase in the level of serum the transaminase AST, ALTs, AST and ALT and ASTs particularly, you understand, which is due to what the damage done to the liver as a result of the infestation of the liver by this particular virus. Okay, this particular acute viral hepatitis has variable symptoms. The symptoms are what variable, and this particular acute viral hepatitis, it could resolve itself by itself, first of all, or if care is not taken, it could lead to what? A chronic viral hepatitis. When you leave acute viral hepatitis untreated, it could lead to chronic what? Viral hepatitis, guys. You understand? Yeah, exactly. And also, not only that, this particular acute viral hepatitis that we're talking about right now, viral hepatitis that we're talking about right now, if left untreated, it not only leads to a chronic, but it could lead to a condition called what? Fulminating what? Hepatic failure, right? Abbreviated as what? FHF. Fulminating liver what? Failure, guys. What do we mean by this fulminating liver failure? It simply means a sudden and progressive what? Failure of the liver to perform its function. That's all. You understand? For instance, now you have a patient who previously has a healthy liver, and then suddenly the liver just stop performing its functions, guys. It's called a fulminating what? Liver what? Failure. You understand? And this particular fulminating liver failure has high mortality rate if left untreated, about 80% mortality rate. If left untreated, it has high mortality rate. You understand? And first of all, the fulminating liver failure, it presents itself as simple malaise. You understand? Malaise. The presenting symptoms of this particular fulminating liver failure. First of all, you have malaise. You have what? Anorexia, and then you have low grade fever. So these are the presenting symptoms of fulminating liver failure as a result of acute viral hepatitis, guys, when left untreated. You understand? Yeah, exactly. Okay, but this fulminating liver failure, it could also give rise to what? Right upper quadrant pain. Patient will be complaining of what? He has pain in his right upper quadrant region, guys. He has pains over there. You understand? The number one cause of death, the common cause of death as a result of this fulminating hepatic failure is what? Sepsis. Common cause, we have sepsis. The patient could easily get septic. You understand? And also brain edema. You understand? Why do we have brain edema? Because this, like I told you, this malaise, anorexia, and low-grade fever, they are the initial presenting what? Symptoms of fulminating liver failure. You understand? But it later progresses into what? The predominant sign of what? Of liver failure, which includes first, like I told you, a right upper quadrant pain and encephalopathies, guys. The patient will have encephalopathies suffering from several pathologies affecting the brain. That's why we have what? Brain abscess, brain edema, and what? Abscess. So when it gets to a very dangerous level where the patient has brain edema, it could lead to death, guys. It could lead to death. Okay, now talking about this the chronic hepatitis. Chronic hepatitis. This particular chronic hepatitis, okay, you can define this as when there is persistence. You understand? When there is persistence, necroinflammatory injury as well as fibrotic injury to the liver. You understand? And this particular necroinflammatory injury and fibrotic injury to the liver must last for at least 6 months. You understand? When we have injury to the liver lasting for at least 6 months, it's called what? A chronic hepatitis, guys. You understand? It's called chronic hepatitis. And this particular chronic hepatitis, if left untreated, it could lead to what? Cirrhotic liver. The patient could develop a cirrhotic liver. That's liver cirrhosis, right? You understand? It could lead to, it could be also, it could be compensated cirrhotic liver, liver cirrhotic. You understand? And also, if a particular, this chronic hepatitis, if left untreated, it could also lead to what? HCC, hepatocellular carcinoma. That's tumor of the liver, guys. So it's very, very important for you to keep on checking the health status of your liver, because you never know. You understand what I'm saying? Exactly. So right now, having understood the general concept about what viral hepatitis, we're going to go into the main subject matter of the day, which is what? Hepatitis B. Hepatitis what? B.